So what we try to do is, again, create some awareness when talking about unhealthy lifestyle or inflammatory lifestyle, right? And so the first thing is getting to understand ourselves as clinicians and as providers, what we're willing to do in our own lifestyle, because expecting that from another person is something that you should kind of expect from yourself. So being aware of where you are on that continuum, and then knowing where your patient may be in that continuum, and again, just having the discussion of where they would like to be, what kind of life they would like to have, and whether they're engaging in the behavior that's consistent with where they want to be. And then, what we do a lot in our presentation is talk about like skills that they can, that any clinician can do in the room with their patient, so relaxation exercises. When we talk about exercise, having the discussion that most of us use a cardiovascular exercise, but the importance of strengthening and stretching and recreation and how those things should be also added into the plan. And then when it comes to sleep is not only looking at, the importance of sleep, but how the medications that we might be prescribing for pain management may be affecting sleep, and then how also the environment in which that person is sleeping and how important that is in order to keep it an anti-inflammatory lifestyle.
We have a health of a nation that we're trying to address. Sure, all of us have our jobs, but I really enjoy trying to help everyone have their greatest expression of their biological health, their biochemical health. I'm going to bring it back to the first lecture again. It's really about love. I really think the greatest feeling anyone can have on this earth is love. At least that's the way it is for me. And I try, again, to impart that on my patients. And health is love, and I want patients, and I know patients want this too. They want to have their bodies and feel their best, and that's what it's about. Yes. One other point, David and I are really trying to help patients to really treat themselves. I mean, he started me on this pathway of like self-management is the key to pain management. And I think together we've also said, well, self-management is the key to management. It's the key to health. If we could teach patients, really, they are the best doctors out there because they live with their bodies every day. They don't need necessarily lab tests and huge diagnostic tests. When they have a test that's going on every day of their life, it's like, how does your stomach feel? How does your head feel? How do you feel? How clear is your mind? You're getting a constant evaluation of your health every day by living in your body. And if we can teach patients better to treat themselves, I think that's also a strong loving way to teach healthcare.
So to go back to the question, okay. It's what is happening in the body, and what we believe in functional medicine is, again, we all have our own genetic code, and it's the environment that we live in that expresses that genetic code. And what we believe that it's happening when it comes to inflammation is that we're not giving the body the best tools that it needs in order to have a very healthy life. And so if we can go back to the basic and looking at the diet, the exercise, the stress, and the sleep, I think we could make a big change in some of our patients' lives.